Hi, everybody. This is Chris Capodice, Mayor Chris Capodice of the Township of Springfield. I appreciate you taking the time to join us today. I do have Mike Fitzpatrick, our health officer, on the line. But before I get there, I just wanted to provide the public with a couple of updates for you. But even before I do that, I would like to thank our Township Committee, Deputy Mayor Chris Weber, Alex Kaiser, Erica Du Bois, Rich Huber. All of us have been together trying to disseminate as much information as we could when we're able to do it. Everyone from our township administrator to the Office of Emergency Management to our DPW, our rec department, recreation, everybody in the municipal building, everybody has just been doing all their efforts to just give you the best information possible when we can get it to you. And we appreciate all your hard work, and finally the residents. We appreciate your patience. This is certainly uncharted territory, and we just want you to know that we're here for you. Couple of updates if you not have heard about cancellations or rescheduling. Real quick, I'm just going to go through some just so you're aware. Springfield baseball clinics and camps are canceled. The garbage and recycling collection will be continued as scheduled. They're still going on. I was just advised that the Hilton Gardens restaurant and banquet hall are closed through Friday the 3rd, which they will then reassess the situation from there. ShopRite of Springfield is now on adjusted hours, open from 7 to 8 o'clock exclusively for our elderly or high-risk residents who want to go there, 7 to 8 o'clock specifically. St. James Sunday Mass and religious education are canceled. Daily Masses still continue. All township parks are closed. Jitney service is running on regular schedule. Senior weekday bus service will run on a modified schedule. If you need to know any information about that from our rec department, you can call 973-912-2227. If you are shopping and you see any evidence of price gouging, please call individuals in our county office. Phone numbers is 654-9845. That's Department of Weights and Measures for Union County. Also, our Consumer Affairs Department will also take complaints of price gouging, 908-654-9840. I was, during this process, on the phone with Assemblyman Bramnick, also Senator Kane, and just as recently as today, I spoke with Congressman Malinowski. He did update me on a few things. For instance, there will be a county testing center for Union County, specifically for COVID. That's going to be at Kane University starting on Monday. Anyone that's not feeling well can be tested. They ask that anyone that has no symptoms, please allow those people that do have symptoms to get tested. Information is forthcoming, including a phone number that you're going to call in advance. But that's the only information that I have. But our county testing center will be Kane University, and information is forthcoming. Our Gateway Chamber of Commerce is going to start a program for all our businesses in town, because I know that is a big loss for us as well. A gift certificate program, more to follow on that. Congressman Malinowski also spoke about a bill that would provide paid sick leave for certain companies and businesses that have under 500 people that are reimbursable. More information will follow about that next week. And he just wanted me to express to you that help is on the way. I know that may not be a great message right now, but it's the best message that we can send right now in terms of efforts on the federal level. And Congressman Malinowski is doing everything he can from his standpoint to help his constituents for sure, as is Senator Kane and Assemblyman Bramnick. Right now, what I would like to do is I would like to bring in our health officer, Mike Fitzpatrick. Mike, are you there?
Yes, I am, Mayor.
Mr. Fitzpatrick, first of all, I can only imagine the things that you're going through with all the municipalities that you serve, and I just want to thank you for taking the time to time out to come and talk to us and me and the residents about different things that are going on in Springfield. I really do appreciate your time. Um,
You're welcome. My pleasure.
real quick, just for people who don't know, can you just give us a little bit about your background in the health industry in your profession?
Sure. I'm a licensed health officer. I've had the license since the mid-1970s. And prior to that, I was an REHS, which is an environmental health specialist. I have a background in education, also teaching science as a teaching field, and I have a master's in health planning. And I have been in the public sector for 25 years, and I was in a private sector in environmental consulting for 20 years. So I both have private and public experience. And I've done several environmental investigations as well as epidemiological investigations. And I hate to say it, but I'm old enough to know about not only H1N1, but if you reach way back to swine flu in the 1970s. So I was involved in that, which was very similar to this, pulling all the resources together. So this too will pass, and we'll all get through it. So that's the perspective of 40 years of a couple different large public health events that I have been involved in.
Oh, thank you for sharing that. So if we could, can you give us the recent update? I know yesterday that I had shared with the residents in the community that we have three confirmed COVID cases right now in Springfield. Can you just give us an update of where we are in Springfield in general, please?
Yes, the three cases that we came in yesterday happen to be a one family group. So they're not three cases, so it's not really per se a community spread of three different individuals at three different parts of town. So that's one piece. And I was just informed about 15 minutes ago with the update that we just sent out that we actually have one additional case. So it's a fourth case. I can tell you that it's an adult. And we are literally in the middle of the investigation as we speak, but it appears that the individual did not have a lot of time spent within the community of Springfield, in and around town, because they work out of town in a different area. So therefore, that doesn't look like there would be a lot of community activity on behalf of that individual within Springfield either.
Well, and I want to talk about that. That brings up a good question. I have heard, and certainly my colleagues on the township committee have heard, and as of residents, you know, oh man, you know, we have somebody who has just got infected. How come we don't know about it? Should we know about it? I want to know if I came in contact with this individual. How come you're not sharing with us, you know, who that individual is, so we could assess if we've been in contact with the person has been infected? What can you say to that?
Sure. I mean, it's an obvious generalized concern. But here's what we'll say: is if it was you or me or a particular individual, we might not want to have our identity shared all over the place. Number one, and number two, there are rules. There are rules of the road when it comes to medical requirements of not really providing private information, and that's called HIPAA. So let's put that aside because that's the legal reason. Here's the practical reason. The state, the federal government, and the World Health Organization have declared this essentially a pandemic. And that means that you have rapid spread throughout multi-regions of multiple countries throughout the world. So it's not that it's important that an individual has the disease, it's the disease that is important. So knowing that it's, John Smith or some fictitious person, that doesn't really help to minimize the spread of the disease by knowing the person. If it was something where it was a singular person, an individual person could do some harm to someone, police and authorities would know who that is, and you might want to put that person's description out specifically to stop that person from doing any more harm. But this is not individuals doing harm. This is a hidden disease that has the potential to do harm. So therefore, it's defined defining cases, not defining people, that's important.
So
Does that make sense?
it does. It does. So talk to me about a little bit about the symptoms, because I wanted to get into the process and procedure of what happens when someone thinks they have coronavirus. But before I do that, I want to kind of distinguish with you what are the differences between a cold, a flu, and the coronavirus. Like, what are the specific symptoms? How does somebody know the difference? You know, if somebody sneezes or has the sniffles, how do they judge whether or not they need to be tested, or if it's a common cold or it really is coronavirus and they need to take action? What are the different symptoms?
Sure. So my first disclosure is I am not a medical doctor.
So in your experience.
No, and I understand. So it's like anything else. When you're looking at a bodily function, you know, the question, and you're not feeling well, is it your sinuses? Is it your ears? Is it your throat? Is it your chest? Is it your lungs? Is it your bronchi? Is it your trachea? You know, is it just that you generally have general malaise? And so really a physician kind of does that diagnostic piece of looking and asking you, the patient, questions. You know, where do you feel bad the most? Is it, you know, your head, your chest? And then they're going to start using tools like stethoscopes, etc., to try to determine, you know, where it's leading them. And then there's some very basic tests that can be done. But as an individual, you know, you're going to be able to say, I feel bad because of. And what I would like every listener to kind of think about, what would you be doing or how would you be responding if this was 8 weeks ago? If this was December, let's say, and you had the same symptoms that you might have now, the likelihood is you would not think of COVID-19 and I need to run to the doctor because I have COVID-19. So the likelihood that most people feeling unwell at the present time could be pneumonia, could be bronchitis, could just be a chest cold. It could be the other coronaviruses that are not COVID-19. It could be a sinus infection, could be an ear infection. You know, so you don't necessarily have to assume because you don't feel well, it's automatically COVID-19. So it's really a diagnostic procedure that a doctor is going to have to go through. But I would caution people, if you don't feel well, and it doesn't raise to the level where you really feel like you need to go to your doctor, or you don't feel like you need to go to the hospital, if this was 8 weeks ago, then you probably don't have to go to the doctor and you probably don't have to go to the hospital. So we don't want hysteria driving people to try to go to their doctor or try to go to the hospital. They just need to think about, what would I normally do if we didn't have this heightened concern?
Okay. So let's say somebody goes to the doctor and gets a test, or they use, you know, any resources that we have here and get a test done. How are you made aware of it, and how does the township, what is the process and procedure? If there is someone who takes a test and it ends up being positive, how are you notified and talk to, and obviously I know this answer, but for the general public, how are you notified of a positive test, and what steps do you take at that point with the individual patient?
Okay, so we may actually be notified of a potential or a suspected case. And not just with COVID-19, but this is what our nurses in our department do all the time, is follow up on communicable diseases. And so you get in this state system called the CDRSS system, you end up getting a computer link that we look at multiple times a day that says there's a new case, tells you what kind of case it potentially is. Influenza, COVID-19, measles, whatever it may be. And then we start tracking it before we even have, per se, a positive result, because it's a suspected or a believed to be. So you start putting all your organizational pieces in order to be able to start calling individuals to see who their contacts are. So by the time we collect all their contacts, we are hoping that we then get a result that either says it's positive or negative, and then we would have to contact the contacts if the case or the individual was positive. So we get it through the state CDRSS system. That's how we do it. And it's an almost a spontaneous system. As the healthcare people, doctors and hospitals put it in the state system, we will get it automatically. It doesn't have to be re-inputted. So we get it very, very fast and almost real time.
So is it safe to say that if an individual was not notified that they came into contact with someone that might have COVID, do they necessarily have anything to worry about?
Well, it depends upon the quality or the closeness of the contact. So a contact of a contact of a contact is of no concern. So like if you're 3 removed, you should really have no concern with transmission. If you're 2 people removed, you probably have very little, you're very low risk, and you can go about your daily business. If you are a person that was in contact with a person that's positive, the question becomes, when? Was it upon them getting sick? You saw them at 3 o'clock in the afternoon on Thursday, and they got sick at 5 o'clock in the afternoon, and they didn't realize they were getting this sick 2 hours later. And you were 2 feet away from them for 10 minutes having a close conversation or discussion. That would be somebody that would be highly likely to be transferring from the sick person to the person that was in the conversation with them.
Okay.
So if you were 5 days away from the day the person got sick, and you were speaking to them 4 or 5 or 6 or 7 feet away for 2 minutes, you probably have very, very low risk of it transferring to you. So it depends upon the length of time you're with them and how mature that virus is, how much it's blooming, and how much it can shed to the new person.
Okay. I want to go into some preventative measure questions, and before I do, I just want to remind everybody who is on watching this now live, if you have any questions, something I didn't cover, and you have a question you'd like me to ask, please write in the comments below, and if we didn't cover it, I could certainly ask it, and again, I'll keep this interview up, on my page so people can go back and refer to it. Let's talk about some preventative measures here, Mike. How about, why this 6-foot distance between each other? Why is it so important to remain, practice social distancing? Why is that important?
It's important because it's believed that the predominant way that the virus is transferred is through droplet spray. So saliva, spit, snot. I mean, to be frank, that's what it is. That's what droplet spray is. So if you're coughing and sneezing, you're broadcasting or spraying physical liquid material, and generally speaking, the weight of that material is going to drop off to the ground or to the person's knee or to their foot before it gets into their face or their eyes. So that's the reason why. So that distance is just a logical distance that will reduce the ability for that liquid material to actually go from a person's mouth who's contaminated or has the disease to someone else. So that's the reason why you say 6 foot. Look, it could be 5 feet, it could be 7 feet, but basically 6 feet is the distance that is being used as a constant at the present time. What is in terms of, there's been a lot of talk about nail salons. There's been a lot of talk about barbershops. There's been a lot of talk about parks. Can you comment on those and what your recommendations are as far as those establishments or those areas are concerned in terms of precautionary measures? Sure, without trying to be in conflict with the governor.
Sure.
I can say the following. I actually called the governor's office this morning. I do have a high level of concern that salons of all types, barbershops, beauty salons, nail salons, and barbershops, are not necessarily essential. And they most certainly do not meet the 6 foot distance. So they could be essential to someone that really wants to have a haircut because they really need it, but it doesn't, from a public health perspective, it doesn't seem to me to be essential. When I read the governor's direction, it says non-essential, 6 feet away, not a lot of people in the room, not more than 10 people. But at the present time, those groups are not under the governor's information piece that says you shall not be in business. My public health approach would be probably not a good idea, because those individuals could be the vector or the transferring piece, because the employees in the shop are going to be seeing so many people that now each new customer comes in, they can transfer it. So I would think that for that reason, it would not be prudent to have those businesses open. That being said, my understanding is many people have decided, I don't really want to go to those type of establishments, simply because I don't know if I'm going to get sick going in and being that close to someone. So it may be almost self-limiting itself to a great degree.
So so I can repeat, so I can clarify, so I understand. Although the governor did not speak specifically to hair salons and manicure pedicure places and barber shops, although the governor might still allow them to be open, your recommendation as the health officer is to be very wary of those places, because it does in fact carry a very, very easy transmittable situation for customers and patrons, correct?
Sure. Yes, if we're being consistent with the 6-foot rule, I would say that that's well within the 6-foot rule, and so therefore, that's how I think that you would have consistency by using places of business where you're less than 6 feet or almost intimate with someone. That should fall into the category of has a higher risk for sure.
So there has also been reports in our town of Springfield, that people are still going out and playing basketball. People are having a catch. People are tossing around a baseball. Do you recommend things like that specifically for anybody at this time, at this stage, or even playground equipment at this time?
So I think the playground equipment might be something that I might want to say would be prudent to not use playground equipment, because you don't know who previous. And I don't think that somebody should go out and start to play basketball with people they don't know and have sporting events. But if you're going out with your brother or your next, you kind of know well, and you're going out, getting some fresh air, doing some things, I honestly think that that probably is a very quality approach to just good living environment. If you're stuffed in your house all the time, you're going to get to feel marginalized. So I think activity outside where you're not in big groups is a great thing. So wipe the basketball down. Make sure you're not playing a hard game where you're checking each other so hard that you're kind of spitting and blowing in each other's face. Have a fun game of basketball. Just shoot some hoops. Don't really play the game. Walk around, have some fun, throw a baseball back and forth to each other. That's the kind of thing that I think would be good, but not competition where you're really like kind of slamming into each other. I wouldn't play basketball that way. Do it more as kind of a fun event.
So you could have outdoor activities. You could take a walk. You could walk your dog. You could play in the backyard, but just obviously be smart about it. Take precautions of, if everybody's playing with the same object, obviously take precautions just to make sure that, everybody's not all over these common objects that people play with, correct?
Right, and it's not just the objects, but it's also being in each other's faces. You ever play basketball? You're trying to go up and put something in the hoop, and then everybody's face and chest are next to each other to block each other out. That I would say you don't do.
Okay.
That's the kind of thing. The contact piece of it I would not do, but all else I would think is appropriate and useful, and just follow the 6-foot rule, and then we should.
And again, I know you've been on for some time with us, and I do have a couple more questions. Just from your perspective, how long do you think something like this is going to last?
So that is the $64,000 question, and if I give you an answer, it's going to be a wild guess based upon having 35 years of experience in the public health and environmental field. It is not a medical or a trend or a data piece. My guess is maybe my hope, and I'm hoping that it trends up and down within 3 or 4 weeks. That's what I'm hoping for.
And what's the best thing that we can do to minimize the spread?
The contact piece. Not going to large parties, not going to large groupings. Now, that was okay to do a week ago. So I think adhering to that from the president and the governor, if anybody is not feeling well, please don't go to groups. Don't be friends, even if it's a group of 2 or 3. Just some reason. So if you are not getting in contact with people that have the disease to a great degree, it's significant. I don't think we can assume we can stop the curve, but I think we can most certainly make the curve flatten out for sure. So the more robust separation we have, the more care we have without isolating ourselves, I think that is the absolute best thing any one of us can do. Because the virus can't last forever. And, after 14 days, essentially, it removes itself, or close to that. The best theory is now 14 days, and then it's going to just die off and not be available as a host in that person's body. So that's the best thing we can do to lower the numbers. Is just keep separate, but we don't have to be isolated separate.
Mike, I want to thank you for taking the time to speak with me and our residents. I know I kept you on a lot longer than I said I would, and I appreciate all the time you're taking and everything you're doing throughout the county. I know there's several municipalities that you serve, and I appreciate you taking some time here in Springfield to talk to us, and I wish you the best in your future endeavors.
Thank you very much, and just let everybody know to keep on washing their hands. That's another real important thing besides social distancing.
Thank you very much, sir. Talk soon.
Thank you. Have a good day, Mayor. Thank you. Thank you.
All right, everyone. That was Mike Fitzpatrick, our Springfield Health Officer. I know that a bunch of people had asked questions. If I didn't get to them specifically, it was covered earlier in the video with Mike. Please refer to this video. I'll keep it up for as long as the situation is going on. But my message to you is just simply wash your hands and stay home. We want to flatten the curve. If that's the buzzword that's going on, I think the best way we can do that, as far as Mike Fitzpatrick said, is basically wash your hands and stay home. If you don't have to go out, don't go out. If you need to go in the backyard, go in the backyard. If you want to take a walk, take a walk. Fresh air is not going to hurt anybody as long as you're doing your social distances. But unless you need to, stay home and wash your hands. If you have any additional questions or concerns, the governor has set up a special line, 211. If you have any questions or concerns, you could also text New Jersey COVID to 898-211. If you need live text assistance, you can text your zip code to 898-211. You could also visit newjersey.gov/health. And lastly, that the governor also set up a 24-hour hotline for New Jersey where trained healthcare professionals are standing by to answer your questions. That number is 1-800-222-1222. If you have any other questions, you could reach out to me on Facebook, or you can call Town Hall 973-912-2202. Our health officer is 973-593-3079. If there's any seniors that are looking for any food deliveries or food transportation, that number for the Department of Recreation is 973-912-2227. Garbage collection, recycling still going on. Public Works, 973-912-8483. And again, if you haven't seen them already, there are drop boxes in front of Town Hall, Chisholm Community Center, and our annex. If you have any paperwork you need to drop off, it can be dropped off for processing. Once again, thank you very much for joining us. I appreciate Mike Fitzpatrick taking the time. Stay safe, stay home, and wash your hands. Thank you very much, everybody.